Hello, this is Nina Reeves from Stuttering Therapy Resources, and I'm here today to continue our video series on speech handling techniques. Our subject today is easy starts. Easy starts go by a number of different names: easy onsets of phonation, and even easy beginnings. They are all the same thing, just by different names. They are an easing in technique, and generally, it is helping a student be able to begin a word, a phrase, or a sentence more easily and with less physical tension. And as a reminder, we've got another few videos earlier in this series to talk about how to set up therapy for success. And we want you to review those videos because it's important that a child knows how speech is made, what happens when they stutter, in order to use tools and techniques effectively. And that includes learning how speech is made in the physiology of your body. So please don't hesitate to look into Chapter 5 of our book, School-Age Stuttering Therapy, a Practical Guide. That really helps you get therapy ready to start talking about tools and techniques. So, as we discover easy starts with a child, the way that each student learns and uses this tool really depends upon their individual level of tension. Make sure that you know, and that the student knows, that tension differs in each student who stutters, as well as in one student who stutters. The amount of tension that they're experiencing may differ from moment to moment, situation to situation throughout a day. Now, I'm going to be demonstrating some easy starts. So let's look at how I would do some easy starts, and then I'll even take you through a moment of how I might discover easy starts with a student, and I'll have you be that student. Now, let me try to demonstrate a few easy starts, and then take you through how I would discover an easy start with one of my students. Remember, there is no one way of doing this. We have to be flexible in our approach and individualize everything that we do with the student that we're working with. So I would begin easy starts at the word level, but not stay there very long, because we don't speak in words. We speak in phrases. So I start with the word level, especially with younger kids, so that they can get that feel of the forward flow of speech and the low level of tension, but move fairly quickly to a linguistic unit that makes sense, which is a phrase. Then carrier phrases can be mixed in there, short sentences, and on to sentences. And of course, when we get to the sentence level, we're going to have to bring in pausing and phrasing, which is another tool and technique we'll be discussing later on in our series. And after sentences, structured conversation, and on to conversational level. Remember, an easy start is not meant to be used on every word. We're going to start out the phrase easily and then flow through the rest of the phrase. Now, this takes a lot of practice, so be ready to teach parents and others what they're supposed to be watching for, so that they can be helpful listeners to the child's homework activities that you're going to be sending home. So here are some easy starts. Follow along with me, even if you know how to do them. Maybe. Nancy. Favorite. Very. Thank you. Thank you. Notice I'm stretching the first few sounds of a word and making sure that I'm starting out in an easy way. Again, we are going to do those longer stretches with students in the early stages of learning this technique. But help remember and help remind the students that we don't expect them to speak this way all the time. This is how we learn in speech therapy to feel that low level of tension. So we have to stretch it a little longer in the beginning. After a lot of practice and more mastery, an easy start can be done this way, which normalizes it and naturalizes it for that student. Please let them know at the outset that things will get more normal and natural as they practice and as they become more masters of this tool. So, you saw me do a few easy starts just at the word level. Now I'm going to do a few at the phrase level. Very happy. Thanks for the birthday cake. This is my new friend. These phrases and short sentences are moving us along in the linguistic level. I'm always going to be encouraging students to practice easy starts in the outside world. Once I see them get mastery at word and phrase level in our structured speech setting, I'm going to be sending home some speech practice, always a level below what we're doing in the therapy room, because there's so many variables in outside world. We don't want to try to stretch too far, too fast. But once a child is mastered, let's say, sentence level here in the speech room, I'll be sending phrases home for speech practice. And they are to try to do some phrases at home and in friend situations, always encouraging them to take tools on the road. Now, let me try to walk you through what I would do with a student for the very first time if we were learning easy starts together. First of all, I would have gone through all of the foundational knowledge and skills that they needed to be ready to make speech change happen. Remember, we have 2 other intro type videos in our series, Setting the Foundation and Intro to Tools, that will help you be more ready for tools and techniques to be more successful in therapy. And of course, Chapter 5 has all of this type of thing ready for you in our book, School Age Stuttering Therapy, A Practical Guide. I want you to be my student now, and I'm going to take you through a little learning about easy starts. So remember, we talked about how speech is made and how our muscles can get really tight, and sometimes we can make them really loose. Well, today, when we're learning easy starts, we're going to be talking about really loose speech muscles. Remember the summary sheet we read in our book and all of the things we talked about with starting out easy? Today we get to practice it together. I'm going to go first, and I want you to go after me. Noisy. Now you try that. Right, I'm going to do it again. Listen again. Noisy. Now, did that feel easy in your mouth? Noisy. Was your tongue was really nice and light up at the top of your mouth? Noisy. That's great. I'm glad it felt easy. Let's try another one. Yellow. Cool. How about this? Yellow cat. Still feeling easy? Excellent. All right. You know, if it feels tight, I want you to just let me know and we'll try it again. We're just trying to take that tension down and start out easy with our words. Now, let's do my mom. Wow, that was a phrase level. You did more than one word. You started out easy, and then you flowed through the rest of your phrase. Let's do that one again. My mom. Okay, We'll do one more. Listen to him. Feeling easy? Listen. Yeah, mine felt easy. Okay. Now we might even be ready for some short sentences. But we want to make sure that we're starting out easy. We don't have to say all the words with easy starts, just those first ones. Okay, so that was how a small, sort of truncated way of me bringing that kind of experience to you. I'm going to summarize some of the points we've had today, and then we'll talk about ways you can learn more. So in summary, today we talked about the technique of Easy Start. This is the technique that helps students ease into speech to enhance their fluency. Students are going to learn Easy Starts at different levels in structured settings and then take the Easy Starts on the road into real-world situations as they increase their level of mastery. Remember, at the beginning of therapy, learning is going to feel and sound and seem a little weird to students because we have to stretch to feel that forward flow. But let's have them hang in there with us as the practice and all of the things that we're doing with them in therapy help to increase their naturalness of the technique. Remember, Easy Starts are not slow speech, and they are not expected to be used 100% of the time. That's an unrealistic expectation. Remember at the beginning I talked about how this is individualized to each student depending upon their level of tension on any given day. Students are always in charge of how much they use, which tool, and when. We're so happy to bring this video series to you. We want to remind you that there's other videos in the series that are already posted and more to come. And please don't forget that we have many practical tips in different languages on our resource page for free for you to download and use in your clinical practice. Don't forget you can follow us on Facebook and Twitter and Pinterest and other social media outlets. And as always, if you have any questions or suggestions of something you would like to see either in our resources or in our catalog, please feel free to email us at info@stutteringtherapyresources.com. Otherwise, we hope you'll look at our catalog and see all of the resources we have available to you already at www.stutteringtherapyresources.com. We'll see you soon.